that we know this has been a very challenging few weeks after what has already been an incredibly challenging year and a half.
The optimism that we had this spring and summer has now faded as the numbers have continued to increase.
2021 has been a roller coaster, with nurses experiencing the highs and lows unlike any other profession. Your North Carolina Nurses Association has been with you every step of the way, and we are grateful for your help in leading nursing forward in spite of the challenges. While associations across the country are seeing steep declines in membership, NCNA has held steady at roughly 7,700 members. Our retention rate has improved since the start of the pandemic, signaling that our members recognize the need to stick together in challenging times. We aim to be the largest healthcare organization in the state by 2025, and we still believe that goal is in reach.
We're thrilled to have so many nurses here today for our discussion on Let's Keep Talking, Diversity, Health Equity, and Social Justice.
Even without most in-person events, NCNA will finish the year with 163 credit hours of continuing nursing education. More than 3,000 attendees have already taken advantage of these opportunities. We also launched a new podcast in 2021 called Nursing Rounds to tell our members stories and promote their priorities, innovations, and victories. As the most trusted profession in the country for 19 consecutive years, nurses continue to be on the front lines of the pandemic, both at the bedside and in front of the camera. Just this year, NCNA and its members have been quoted in at least 70 different news stories about COVID-19.
Most people are prepared to be asked to work longer hours, more shifts.
NCNA is also helping lead nursing forward in other areas. As part of ANA's RN Connect self-care program, we helped secure 391 subscribers, representing 10% of the total subscribers for the entire national program. And in the coming months, we are excited to launch a new partnership through Project First Line to promote infection control training and best practices. At the General Assembly, NCNA has steadily built on momentum for the SAVE Act, which would grant full practice authority to advanced practice registered nurses. This bipartisan bill has more than 100 co-sponsors, a huge improvement over previous efforts, and has generated dozens of media mentions. In 2021, we have added 8 new organizations to its growing coalition of support, including names like Blue Cross Blue Shield of North Carolina, Amazon Web Services, and the John Locke Foundation. Optimism remains high that we can get this bill across the finish line before the end of the 2022 short session. Meanwhile, we have continued to push for Medicaid expansion, school nurse funding, increasing nurse faculty salaries, and other strategies to alleviate the nursing shortage. The NC Nurses PAC is on pace to shatter fundraising records. As of mid-September, we had already collected close to $40,000, putting it in position to total more than $58,000 by year's end. This is vital for our efforts to support nurse-friendly legislation and candidates like our own NCNA members in the General Assembly, Representatives Gail Adcock, Carla Cunningham, and Donna White. NCNA has worked with a host of organizations like NCDHHS, the North Carolina Medical Society, NCAHEC, and the North Carolina Healthcare Association to help spearhead the state's coronavirus response. We have organized volunteers and helped promote the safety and efficacy of vaccines. These various campaigns have strengthened our relationships with other healthcare organizations and should pay dividends in the years to come. 2021 also saw the return of our Leadership Academy, with participants from both NCNA and the North Carolina Association of Nurse Anesthetists. Congratulations to the graduates celebrating this week. 2021 has not been an easy year, but it has proven that NCNA and its members are determined to lead the nursing profession into a brighter future. We deeply appreciate your support and thank you for your continued membership.
We are thankful for each and every one of you.
Thank you for the fight. Thank you for advancing nursing forward, and we appreciate you. Have a blessed day.